Hey everybody, um, welcome to episode 4 of my life with OCD. Um, I think I've pretty much covered most of my life of how it started and what how I've come to have it become so prominent in my life. Um, the most recent tragedy that has exacerbated my symptoms, because as I've said before, my official diagnosis is obsessive compulsive disorder, obsessive compulsive personality disorder, post-traumatic stress disorder, generalized anxiety disorder, and Tourette syndrome. And as you can see from the different medications I've been on, my memory is a little messed up. I used to have a picture perfect memory, and now not so much. But the most recent tragedy, in 2006, my dad was diagnosed with cancer. The day before Thanksgiving 2006, they tried to remove the tumor out of his abdomen. He was very happy because he had been sick for so long, and he felt that they were going to get the tumor out of him and that he was going to feel better. So everybody was happy, the entire family. The surgeon performing the surgery was the same surgeon that saved my mom's life when she had her accident in 1999. So, needless to say, I was very happy that it was the same doctor. They took my dad into surgery, and 2 hours later, the doctor came out with the most stoic look I've ever seen on anybody's face. And he said that there's nothing that can be done. The tumor is about the size of a soccer ball, and it's attached to all of my dad's internal organs. If they remove it, he'll bleed to death. The reason that my dad was complaining of always being hungry is because any nutrients my dad put in his body was going straight to this disgusting, evil tumor. And that was pretty hard to hear. I managed to keep it together until I heard the doctor say this. He said, "Your dad's not going to live another year. I'll be surprised if he lasts another 3 months." Basically, he's going to starve to death. And needless to say, I lost it. I couldn't hold it together. We were told that chemotherapy wouldn't work, and the doctors asked us not to say anything to my dad until the next day, because they wanted all the surgeons, the kidney specialists, the oncologists, and the entire family to be present when they told my dad that he was terminal. So for the rest of the day, as the family and friends came and went, we had to pretend that everything was okay. And my dad was so happy because he thought they had taken out the tumor. He thought he was going to start feeling better. Anybody that's been put in that gut-wrenching situation knows how awful of a feeling that is, to not be able to tell your parent that they only have a few months to live. So the next day, which happened to be Thanksgiving, which I now call Dark Thursday, they told my dad. We were all there, and it was very difficult because I could see the pain and the fear in my dad's eyes. His family convinced him to go through with chemotherapy against mine and my mom's wishes. Keep in mind, my mom had power of attorney, and I was the first on the advanced medical directive. But they convinced him, try chemotherapy. But it only made his quality of life worse. So what little bit of time he had left was stripped from him because of the stupid chemotherapy. Anyways, I don't mean to go off on a tangent, but it's still a very emotional subject for me. I think about him every day. I miss him every day. But what this has to do with OCD is that, when my dad started chemotherapy January 2nd, 2007, he was fine for the first 2 days. Then, the third day, my mom called me about 2:30 in the morning and said she was going to pick me up, take me to the hospital, because the nurse called her and said that my dad was hallucinating. He was talking to his mom, who had passed away a few years earlier. And when I got there, nothing prepared me for what I saw. My dad was speaking in a language that I've never even heard of. He didn't recognize me. It hit me so hard that I had to run to the windowsill to hold myself up. And when I got the strength back in my legs, I ran out of the room and I bawled like a baby. So from January 3rd to the day that my dad passed away, I was there 24 hours a day, 7 days a week. And when you watch a parent who's always been so strong, who's always been able to provide for you and care for you, wither away before your eyes, I can only begin to tell you how painful that is. We had to take him off life support January 25th. The oncologist, Dr. Hasib, from the Cancer Care Center in Fresno, was very disappointed. He gave my dad a shot of dextrose to try to reverse the morphine, and that gave my dad his 5th and final heart attack that day, which I had to see. A vision that haunts me every day. Sometimes I'll be watching TV, playing my guitar, or whatever, and the image of my dad having his heart attack pops into my head. But when he told the doctor enough was enough, Dr. Hasib's eyes filled with tears, and he said that he was sorry that he couldn't save him. The guilt that I carry with me is that I couldn't save my dad either. I tried. I tried with all my might, and I couldn't do it. Now, what this has to do with my OCD and the other problems that I have is that OCD creates guilt, mostly false guilt. And because OCD is known as a doubting disease, and the reason they call it that is because it makes a person doubt everything. Did I lock the door? Did I turn the stove off? Did I leave the iron on? Did I just think a blasphemous thought? Did I just commit a sin? Did I just run over somebody with my car? And for me, it's, did I do enough? Did I do enough to help my dad? Did I disappoint my dad? I never got to ask him that. I wanted to, but I never got a chance to ask my dad if I ever made him proud of me. I urge all of you watching this, whether you're family of mine, friends of mine, or you just happen to stumble upon this video, to treasure your parents. If you've become estranged, call them, talk to them, because you only get 2 parents in your life. And when they're gone, and you're on your own. And you won't ever get that time back. When you leave things unsaid, it haunts you. Now, with the OCD, that's just one of the many things that I carry with me as far as guilt goes. Excuse me. Now, to delve a little bit into the medical aspect of OCD, I'll try and be as speak in as much layman terms as I can, because I'm actually reading out of the OCD self-help book that I have. But there's really no one's been able to figure out what causes OCD. It is an imbalance of serotonin in your brain, and they've found a link to children that have had strep throat when they were young develop obsessive compulsive disorder as they grow older. Now, me, I used to get strep throat every year from before I was in kindergarten to well into high school. So that's probably what happened, part of what happened with me. You become hyper aware of everything around you because everything feels like a danger. Everything feels like you've got to constantly be on guard. You've got to you feel like you need to have 360-degree peripheral vision because you feel like there's something bad, someone just waiting in the wings to come and attack you, and that's that flight or fight response. And that's what OCD does. It makes you doubt. It makes you wonder. It makes you go over things over and over and over again. And it involves several parts of the brain. The medications that are most often prescribed are antidepressants known as SSRIs, or selective serotonin reuptake inhibitors, or SNRIs, selective serotonin norepinephrine reuptake inhibitors. I can tell you from my experience that I have treatment-resistant OCD, so none of those medications have worked for me. There is promising research that opiate medications do help a lot in reduction of anxiety and OCD symptoms, but none of my doctors want to let me try that, even though I've told them over and over and over again that the frickin' medications that they keep giving me don't work. I mean, seriously, I'm on enough medication to knock out 3 elephants. I mean, 2 milligrams of Xanax a day, 100 milligrams of Pristique a day, 200 milligrams of Seroquel a day, 50 milligrams of hydroxyzine a day, 10 milligrams of Ambien a day. I mean, it goes on and on. But that's me. I'm not saying it won't work for you. Find a psychiatrist. Find one that you feel comfortable with. Don't go for the first one you see. Find a psychiatrist that you feel will help you, that listens to you, that doesn't cut you off, and doesn't say, okay, well, here's this medication and that's it. Find a psychiatrist. If you don't have insurance, there are free programs for mental health in just about every county here in California. And find a psychologist. There is also a lot of places where you can talk to a psychologist for a very reduced amount. Now, this video is getting a little long, so I'm going to cut it off here. But stay tuned and keep watching. Thank you for watching. I will come up with my 5th episode within the next couple days or so. Alright? So I will see you guys then. Bye.